Mr. President, I've come to the floor on several occasions now to talk about this $1.9 trillion spending bill that will be soon before this body. I've talked about different parts of the bill on different occasions. I've talked about the mandates, the bailouts, and the billions and billions of dollars of spending completely unrelated to coronavirus. Now, these are all reasons enough to oppose this piece of legislation. Today, I'd like to talk about another problem that I see with the bill, and that's that this bill would now subsidize health insurance far beyond what was ever imagined when the House and the Senate passed the Obama health care law, way beyond the subsidies ever envisioned in that. One analysis shows that this bill would give a family of four making close to $250,000 a year, family of four making close to $250,000 a year, up to $9,000 in free subsidies for health care. Now, that's not 4 times the poverty level, that's almost 4 times the average income of a household in the United States. You know, government aid is supposed to be for those who need it, people who can't make it on their own. But that's not been the focus of the Democrats with this legislation. This legislation is not about coronavirus, not about coronavirus testing and vaccination. They've already been paid for, so that someone who wants to get a test or gets a vaccine, they get it. It's paid for previously. The vaccines are free. We don't need additional money to pay for the shot. We voted on that last year. It's the law of the land. This new proposal with these additional subsidies is just going to get us this much closer to one-size-fits-all socialized medicine. Now, Democrats have realized for many years that the Obama health care law has failed America. They know it's unaffordable for working families. People understand that the co-pays are so high, the deductibles are so high, that people that have been mandated to buy it found that they didn't really getting any value for their money. Many people I've talked to said with Obamacare, the premiums were so high, it was actually higher than their mortgage at home. Well, Republicans want to lower health care costs, actually the cost of care. Democrats seem to just want to raise what government pays. And Democrats are also trying to pressure states into expand Medicaid. There are about a dozen states that have chosen not to expand Medicaid. Now, I'm a doctor. I know the importance of Medicaid. I know the importance of providing care for people who cannot care for themselves. Often that is families, low-income families, pregnant women, patients with disabilities. You look at the original intent of Medicaid, huge value for the American people, but not with what they've seen with the Obamacare expansion. We should work together for these most vulnerable of individuals so that they can get the care that they need. Yet, it's not what Democrats are doing with this proposal, not with the additional subsidies, not with the additional expansion of Medicaid. They're trying to bribe states to give free care to able-bodied working adults. Not the people that were originally intended to be helped by Medicaid, but for able-bodied working adults. Mr. President, those are people who ought to be getting their health insurance through their job, through work. That's the best way this works for them, insurance that they can use without these extraordinarily high deductibles and co-pays that we see with Obamacare. The contrast could not be cleaner, Mr. President. Republicans are offering the American people a stronger economy and opening schools. That's what we ought to be focusing on. Democrats in the health care law is subsidizing health insurance for the rich. It's astonishing. You wouldn't think it would be that way. It doesn't make sense. It's not coronavirus relief. People need relief now. They want their kids back to school. They want to get back to work. They want to put the virus behind them. That's not what I see in this $1.9 trillion bill that the Senate will soon be considering. I think only $1 out of 11 of this $1.9 trillion bill actually goes to help get people back to work, kids back to school, focuses on the health care components of coronavirus. The kids back to school component, you say, well, there's money to put kids back to school. 95% of that money doesn't even start to get spent until 2022. The coronavirus crisis is going to be beyond us and behind us by 2022. Mr. President, we should be working together, targeting support for the American people who need it the most, not subsidizing people who don't actually need the subsidies. Thank you, Mr. President. I yield the floor. Suggest the absence of a quorum.